Live well now with Dr. Lauren.
Hello, everybody. This is Dr. Lauren Powell, and this is another episode of Live Well Now, where my goal is to give you some practical strategies, tips, some cheat codes, some tools to really help you improve your health so that you can live well, not later, not when you're older, not tomorrow, but right now. Because you have a mission, you have something that you need to accomplish. There's something that the Lord has for you to do, and we need you to feel well so that you can accomplish the goal that you've been placed here to do. So today, y'all, I am officially 40. I'm officially 40. Don't tell anyone because I'm still claiming I'm in my 20s. But I'm officially 40, and so I wanted to talk to you. I briefly talked about it on Instagram. I thought I would do something long form here to talk about getting a physical in your 40s by a primary care physician, what that looks like. So I want to kind of put two views together. I want to give you information perspective as a patient, and then I want to give you some information as a provider, as someone who's taking care of people. You guys know I'm a family medicine physician, so I'm board certified to take care of newborn all the way to geriatrics. My practice currently is ages 16 and up. I see quite a few women that kind of are just like me. I think sometimes we tend to attract like folks. So I see a lot of women who are in their 30s transitioning to their 40s and in their 40s, and etc. So today I want to talk about turning 40, what your annual physical really should include. I want to teach you how to prepare for your visit, and I want to teach you how to get the most out of it. Okay, so let's get started. Get a pen, get a paper, let's take some notes so that you can remember this when it's time for your physical. And I'm saying when you're in your 40s, but really a lot of these principles you can apply anytime during your adult physical. These things are really, really important. And so before we kind of go through the nitty gritty and details, I want you all to know that you should feel very comfortable with your doctor. Like, you're talking about, sometimes they're intimate, very, very private things. And so you want to feel comfortable. And so if you're meeting with a doctor for the first time, sometimes it's good just to do a meet and greet visit. Maybe it's not the visit where you get your physical done, but you just meet and you talk and you see if it's a good fit. Because you don't want to go into your physical, and you don't feel comfortable, you feel rushed, it doesn't feel, y'all know, you've maybe gone on a date and you've gone and you're like, ugh, man, this just doesn't feel good. You should feel good during your visit. I like my patients to be excited about their visit, because sometimes I'm only seeing them once a year. So it's a great time for us to catch up, see how things are going with their health, and talk about the goals for the year. So I want to give you just some framing and some words to use in order for you to just best advocate for yourself. And sometimes it's helpful to have someone with you. If you're someone, like I have some younger adults who this is their first time going to a doctor by themselves. So maybe a parent wants to come with them, or an older sibling. And I think that's fine. And I think the goal, though, should be that we equip that individual with tools so that they can properly advocate for themselves during these visits. So I just want to give you some tools. I want to give you some tips, and I'm going to give you some words to use to help advocate for yourself during doctor visits. So if you're ever feeling rushed, you should speak up. You can simply say, hey, can we just slow down for a moment? I want to make sure that I'm understanding everything. Completely appropriate. This is your visit. If something, as doctors, we know a lot about a lot of things. And so sometimes we understand that something may not be that big of a deal in the grand scheme of things, but it's a big deal to you. Or maybe you don't understand it well enough to know that it's not something that we need to be super concerned about. But you can simply say, if you're feeling like a concern of yours or something is dismissed, you can say, even if this seems minor, it feels new and it feels different to me. So can we explore it together? That's great language to use. Ask about your numbers. Sometimes we'll say, a lot of times when I do visits, I'm telling patients in advance all the things that I'm going to be checking. Hey, I'm going to be checking your cholesterol. I'm going to be checking your thyroid. I'm going to check your stuff. So when I'm going over results, I'll say a lot of times, your labs were normal. In my mind, I'm thinking, I told you beforehand what I'm going to be checking, so those things are normal. But if you need to hear it, if you're like, hey, tell me again, what does this mean? What does it mean to have normal cholesterol? What does it mean to have normal labs? And so you can ask for those specific breakdowns if that's helpful for you. At the end of the visit, I always try to do a little summary, both for myself and for the patient. So a way you can ask for that if you feel like you're not really clear on where we're leaving off and what is the next plan, you can simply say, hey, can you summarize for me just, everything we're doing and what the next steps are so I can make sure that I'm clear? Perfectly appropriate and a great question to ask. Also, listen, feel free to be organized and bring your notes. I love it when my patients take out their notes. And sometimes I will feel they have notes or they don't want to share them with me. And I'll just say, hey, do you want me to just read it? And I can like read it out loud and we can talk about it. And, sometimes that feels better for them to just hand me their notes and let me read it and us talk about it than them trying to read it to me. So feel free to be organized, bring notes, and bring things that you want to make sure that you bring up. All right, let's get to it. So your annual wellness visit, this is your physical. This should be an exam where you don't particularly have like specific concerns, right? You're not coming in saying, I'm having chest pain, I'm having difficulty breathing. Like this is your wellness visit. So you should overall feel well so that we can do screening, we can talk about prevention. So sometimes if you kind of have a lot of stuff to talk about and you want to do a physical, it's hard for us to do all of those things really well in a visit. Sometimes I'll try to, accommodate a patient and do all the things that they want to. And every time I'm almost like, oh my goodness, this is just way too much. Because if I'm overwhelmed by everything, I know that the patient is too. So feel free to break those things up. It's okay. We can see each other multiple times. You can see your doctor as many times as you want throughout the year. It's not that you can only see them for a physical. I have patients that come in and just check in. I have patients that come in every 3 to 6 months. They don't necessarily have anything, but they just want to check in. They just want to tell me what's new and how things are going. And I think that's great. So that's number one. Number two, so baseline measurements. We're always going to get your height and your weight, right? Because that helps us calculate your BMI. Now, some of us have love-hate relationships with our BMI, and that's okay. It's a tool. It's one tool in the toolbox. And what I really like to use it for is I like to see how are things changing over the years. I was looking over some lab works in my phone that I have from residency, so back in 2014, and I looked at what my cholesterol was, and I was looking at my weight and my BMI, and I was seeing how things changed. And I had to ask myself, is that something I'm okay with? Or is it not? Are there some changes I need to make based on the trends that I'm seeing? So that's really important. And you want to know how you feel in your body. So whenever I talk about a patient, we talk about weight goals. I ask them to remember a time where they felt really good in their body. And like, oh, back before I had kids, I felt really, really great in my body. I love the way my clothes fit. I felt like I could move. I felt active. And so I like to just reference how you felt in your body at different stages of life and reference those BMIs and weights. Next is blood pressure and heart rate. If you've seen, we've done another episode all about blood pressure. Blood pressure is such an important vital. You should kind of know what your blood pressure runs so that when you go to the doctor's office, it's not a surprise. It's not, oh, I had no idea that my blood pressure was slowly increasing. Also, sometimes when you go to the doctors, your blood pressure is a little high. And so you need to know like, oh, this is like not really what my normal blood pressure is. I think I'm nervous. Do you think we could recheck it at the end of the visit after I've settled down? And that's completely appropriate. Next, we want to go over your personal and family history. The more you guys know, the better. So I'm a female. So one thing that my doctor asked of me is, is there any family history of breast cancer? And I want to know what age was that person diagnosed. And I want to know what treatment they had, because if I know what treatment they have, I kind of know what kind of breast cancer they had. Do they have to have surgery? Did they take medicine? Are they still taking medicine? Are they cancer free? I want to know then if my patient has any breast symptoms, like have you had breast symptoms before? Have you had lumpy, bumpy breasts where you've had to get mammograms or ultrasounds before the age of 40? Why did that happen? And what was found and what's supposed to be the follow-up? Same thing with colon cancer. I want to know, is there any family history of colon cancer? I'm 40. We start colon cancer screening at 45, but we start earlier if there's any family history. So my father has a very significant colon history. He's had colonoscopies beginning in his 20s, sometimes every 6 months. He's, had some ulcerative colitis, just lots of things going on in his colon. So I actually had colon cancer screening years ago, just out of overabundance of concern, some symptoms I was having. And so they said that at that time that I could just resume screening at normal screening age. Back then it was 50, now it is 45. So I want to know, what is your family history with breast and colon cancer? I really want to know any cancers, any cancers in the family. I really want to know about breast and colon because that's going to influence when I screen you. We have 2 ways to screen for colon cancer at this time. Colonoscopy, which is the gold standard. You guys know you have a solution that you drink the day before. We go up with a camera. They're able to look in the colon and see if there's any polyps, clip them, biopsy, send them to the lab. Colonoscopies are great because not only are we able to screen, we can almost, we're able to clip biopsies and clip abnormal things that may be benign, but maybe in 10 years from then, like they could have grown and become something abnormal. So that's why colonoscopies are great. Now, for patients who have absolutely no family history, they have no symptoms, we may consider and have conversations about Cologuard. Cologuard is a great alternative. Again, it's for patients that are completely asymptomatic. They have no family history, no personal history of any kind of colon disease or colon issues or or anything, like feel good, no issues, no family history, then we may consider Cologuard, which is a great screening tool. It's a kit, it's mailed to your house. You basically poop in a sample, you send it back. And if that's beautiful, then it's repeated in 3 years. If there's any issues, if it's inconclusive, if it's something abnormal, then you will proceed with a colonoscopy. Next, we're going to talk about blood work. So please, you guys, make sure that you're fasting. Some thoughts are that it doesn't make a difference, but I have definitely noticed a significant difference when people are fasting versus not fasting. I always like a minimum of 4 hours, depending on what lab and what things that may require a longer fast. But 4 hours is generally good. You want to drink lots and lots of water because we want you well hydrated so that your blood flows very easily. I have a friend who has she's a very hard stick, and she literally has to think about that she's getting her physicals 2 days ahead so that she can really start aggressively hydrating herself. So hydration status is really going to make it just easier to draw your blood and make that whole experience a lot smoother. Another thing I ask patients to do is to pause their supplements for 2 to 3 days, just depending on what they're taking. Sometimes I notice just some false elevations. For instance, I've had a patient the other day whose kidney function showed it was abnormal, and then it turned out they were taking some creatine, and so stopped it, rechecked it in a couple days, and it was fine. So sometimes it's just best to kind of hold on those supplements before your visit. Okay. Other things we're checking: a comprehensive metabolic panel. That's going to have your fasting glucose, your liver function, your kidney function, your electrolytes. Your CBC, that's going to look for any anemia. It's going to let me look at your white blood cells, all those things, clotting cells, overall trends. Again, I'm looking at how things vary from year to year. Your diabetes screen, and we do that in a variety of ways. We have an A1C that tells me what your glucose has been doing over the past 3 months. So if you're someone with diabetes, generally that's being checked every 3 months for that reason. Is this reflective of the previous 3 months? Let's see what else. Lipid panel, your LDL, which is, we used to call it the bad cholesterol, your HDL, which is the positive cholesterol, your triglycerides. Again, fasting, I find your lipids are very sensitive to fasting. Sometimes patients need an advanced lipid testing, and that's going to tell me the particle size. It's going to tell me about ApoB, Lp(a). These are also independent risk factors for cardiovascular disease, and so they tell me, just specific information. It tells me about genetics, and especially if I've had patients who've had some abnormal cholesterol in the past, they're young, I definitely want to kind of investigate a little bit deeper so that I know how aggressive I need to be with regards to their risk for heart disease. Thyroid function, we're going to look, screen for thyroid dysfunction in women especially, and then vitamin D. And 90% of African Americans tend to be vitamin D deficient. Vitamin D affects so many systems of the body, so I'm generally screening for vitamin D. Additional tests that I may consider at 40 is a CT calcium score. This is useful if patient has had elevated cholesterol, if they have any family history of heart disease, if I have any concern about their long-term risk of heart disease. The goal is to have a score of 0. This is looking for calcium or plaque in the vessels surrounding the heart. The only negative thing I feel like about a CT calcium score is that sometimes while it's getting the heart, it kind of gets part of the abdomen too. So sometimes we pick up weird things in a liver lesion that's benign, but then we have to go down this rabbit hole of checking some other things. So don't be alarmed if that happens. You do something for your heart and then they follow up and say, hey, this about your liver, this about your kidney. And you're like, what? I thought it was checking my heart. So that sometimes happens. An additional test that's good to do is a baseline EKG. Again, if you feel well, this is a good time to just look at that. We can see your intervals. We can just see how your electricity in your heart is working. I just like a baseline when someone feels well. That way, if anyone ever feels bad, if they come in and they have chest pain one day or difficulty breathing or they're feeling palpitations, I have something normal to compare it to. Now, insurance doesn't always cover a baseline EKG, so there may be a cost incurred, but I do think it's something that's still valuable to get. Your pap smear, it's the thing that we do not enjoy very much, but if you're a woman, it's something unfortunately we have to do. So I want to know when my patient had their last one, if I didn't do it, if they had it done somewhere else. When was your last one and what did it show? Super important, you guys, because what it showed determines when we repeat it and what follow-up is needed. So it's not enough to say, oh, I think it was normal, nobody called me. It's not good enough to say something was abnormal, but I can't remember what. There's such a spectrum of abnormalities in PAPs, little abnormal, middle bit abnormal, and then, very abnormal. So kind of what abnormality is determines kind of what the follow-up is, whether we repeat it in a year, whether we do a colposcopy, all kinds of things. So please, if you're establishing with a new provider, try to go through your records and kind of find out what your last pap smear showed so that we can make sure we're doing the appropriate follow-up. Another thing I ask patients, and this is not specific to them being in their 40s, this is just all women, and that's about their menstrual cycle. Oftentimes women don't know what's like a normal cycle because they only know their cycle. They may know their mom's cycle, they may know their sister's cycle, but like that's it. So what I find often is that patients are having very abnormal cycles, but they don't know it's abnormal because it's been their normal. Like it's been what they've had their whole life. And so if somebody's having pain, if they're passing clots, if they just feel debilitated for the length of their cycle, that's not normal. If they're bleeding through clothes, if they can't go out during their cycle, like that's not normal. And so we need to have a conversation about why that may be. If they have anemia related to your cycles, that's also not normal. That means that your body's not able to replenish the blood fast enough that you're losing it. So that's not normal. We need to have a conversation. Additionally, some patients start having perimenopause symptoms in their 40s. There's a lot of conversation about menopause and perimenopause. We can do a whole episode about that. But menopause is defined as 1 full year without a cycle. So all the time before that, when your hormones are fluctuating and changing, usually starting around 35, that's called perimenopause. And some people have mild symptoms during their perimenopause period. Some people have a lot of symptoms. They have hot flashes, they have mood swings, they have issues with brain fog and remembering things. They may have issues, hard time losing weight and maintaining their weight. And so, having conversations with patients about what symptoms they may be experiencing, what we can do about it, talking about it, what lifestyle things that we can implement, if there's some small tweaks that we could make that could really help them. Sometimes I notice this is when patients need to change up what they're doing in terms of their physical activity. What they're doing is not working, and it's time to maybe incorporate more resistance training, things like that. I also like to talk about, and again, this is something I talk about to women really at all age, but family planning, because women are having children later in life. And so sometimes we think having kids should look a certain way, and then we get to the age that we think everything was supposed to come together, and it didn't come together the way that we thought it was, or we think that it's supposed to. And so I ask my patients, what do you think about children? And I just kind of leave it open-ended. And some will say, yeah, I don't really want to have kids. Or some will say, I always wanted to have kids, but I just didn't imagine being 40 and, single, or and not having kids. But it is something that I've always desired. And so we'll have a conversation about what are the different ways that people can become a mother and what that could look like for them. But I think we spend a lot of time having conversations with young women and women about what we can do to not get pregnant and all those things. But, having conversations about what does it look like to desire children, and what are some things that we can do to kind of think about our fertility in advance. Because it's difficult to get to a place where you desire to have kids, try, and then run into issues, but no one has ever talked to you about it beforehand. So you're just out here and you don't know what to do. You don't know who to talk to, what options you have. You just think that this is just what it is. And that's just not always true. So talking about family planning is important. Next is lifestyle. This is the stuff that I like talking about the most. I ask patients, what does their nutrition look like? And if they can't be specific enough with me, I'll just ask them what they ate in the last 24 hours. I like to know this because when I'm looking and interpreting their blood work, I want to know in the back of my mind, and I want to look through the lens of what is their nutrition like. Is this someone that cooks their food? Is this someone that eats a lot of processed stuff? Is this someone who eats all food groups? Is this someone that doesn't eat any meat? And so I need to be looking at from the lens of, this is a non-meat eating person. Is this someone that eats, again, only deep fried? Like I want to know what their nutrition is while I'm looking at their lab work. I also want to know what their physical activity looks like. Is this someone that's mostly sedentary? Are they not exercising? Are they sitting most of the day, having a hard time of when to incorporate physical activity and things like that? So those are questions that I want to know so that I can have those in mind when I'm interpreting lab results. Sleep is huge. Sleep is so important to the body. It's important for our immune function. It's important for our brain health. It's important for our heart health. It's important for so many things. And so many people are not sleeping well, and they're not sleeping well for a long time. And they just have come to terms with this. They don't sleep, but please talk to your doctor if you're not sleeping well. When I say sleeping well, that means that you should be able to fall asleep 15, 20 minutes or so. It shouldn't take you hours to fall asleep. You should stay asleep. And then when you wake up in the morning, you should feel rested. You shouldn't feel like you want to get back into bed. So if that's not happening, let's have a conversation about it. Let's see, sleep. I want to talk about people's mental health. How are they doing overall? Do they find joy? Do they have friendships and relationships? Are they in community? Because I don't think people should be doing life alone. So just having a conversation about it, encouraging people to look for community if they don't in different places, and just kind of pulling out different things. Well, hey, I thought you really liked going to church. Oh, I do go to church. So there's no people around your age that kind of hang around after. Well, sometimes we do. Well, why don't we encourage you? Why don't we get you to do that just one time and see how it feels? I know it may be a challenge, it may be something different for you, but what would it look like? How would it feel if one Sunday you stayed back after and, invited someone to coffee or invited someone to go for a walk? Like, well, how would that feel? What do you think? And so just exploring people to really assess their health from an overall perspective, and relationships are a big part of our health. Next is cardiovascular risk. So, heart disease is the number one killer of all people. It doesn't matter your race, it doesn't matter your gender. It is the number one cause of death. And at 40, I'm thinking about it a lot. And for a lot of reasons, obviously our risk goes up as we get older. But I feel like in our 40s, and I don't think this is just me, I feel like this is true for a lot of people, our lives get really busy. Our lives get really busy. We have lots of transitions, kids, career, household. Like, there's just like a lot of stuff happening in your 40s. Sometimes it's even starting earlier than your 40s. But I feel like how you are still able to take care of yourself during this transition or this time. And I feel like this busyness that starts in your 40s or in your late 30s, it doesn't really change. Like, I had a kid 3 years ago, I was in my late 30s, and that level of just busyness and added responsibility doesn't seem to go away. I feel like it changes, right? When your kid gets older, maybe you don't have to worry about waking up in the middle of the night for feedings, but you have other things now that you have to manage and think about. So I feel like in our 40s, so many things in our life change and things get really busy. And I think it's really easy to neglect yourself. I think it's really easy to make sure your family is well and not be exercising because you would rather get an extra 30 minutes of sleep because you're tired, because you have so many responsibilities. Work is demanding. People are oftentimes trying to climb up in their career or do different endeavors. And so I feel like how we handle all these different stressors that come at this stage of life kind of sets the tone for our future health. Because you can decide to be like, okay, I have a lot of stuff happening in my life. How can I still prioritize my health in the midst of it? And even if it's something small, how can I at least make sure that I'm still moving throughout the day? I'm sitting, people are working from home. How can I make sure that I at least continue to move my body? How can I make sure that I at least still cook a couple of days out of the week? How can I make sure that I eat some vegetables and some fruit? So I think it's a big thing to talk about in our 40s, because I feel like so many habits and things kind of get reset in our 40s, and it's either things that kind of serve your health well or don't. All right, so I want to talk about patients' risk for heart disease and what risks can we change. So talking about their nutrition, talking about their movement, talking about their labs, talking about, do we need to do some advanced cardiac screening? Do you need a stress test? Do you need an echo? Like, what other things are going on that that will allow us to further assess your risk for heart disease? What things can we change? Are there medications that we need to be considering? Do we need to be aggressive about these type of supplements? There's just a lot of things that kind of goes into our cardiovascular health that I really like us to focus on in your 40s. The next thing I want to talk about are some mistakes that people make during their physicals that I don't want you to make. I don't want you to make these. So the first one is not knowing your family history. Sometimes it's hard. People are adopted, people are estranged. So there's sometimes that you just don't have the opportunity to know your family history, but sometimes we just don't ask. And sometimes family members aren't open about sharing, but it's really important. And I hope you guys have learned your health and what we do for you sometimes is influenced by your family's medical history. So saying things like, oh, somebody in my family had some kind of cancer, I don't know. Grandpa had something, I don't really know what it was. That's not really helpful for us. The more specific, the better. Hey, my grandfather had a abdominal aneurysm. He had to have surgery. Something happened. He was in his 50s. Like, that kind of stuff is what's helpful, and that's the information we want you to come to. your doctors with. Saying everything is fine when something feels off. Like, you're the boss of your health. You have all the data with regards to your health. So we need you to be honest with how you're feeling. You have all the information. So unless you tell us, we're not going to know. So sometimes I'll ask patients questions and they'll say answers like, well, it's yes and no. Like, what does that mean? You got to tell me what that means. What does that mean for you? And the more specific you can be with me, the more that I can partner with you to help. I always want people signed up for whatever patient portal there is, because you want to have access to your medical records. It's really important. So if you don't like portals, asking for, I have some of my older patients that don't like portals. They ask for me to mail their labs. That's no problem. But I think you should all have copies of your lab work, because again, this is your health. Something could happen to me. Something could happen to your doctor. Something could happen to your health system. And you want to be able to have access to your own records. Not mentioning supplements. Patients will tell me after the fact, oh yeah, I forgot to tell you, I take a bag of whatever. Bring your supplements to your visit. It makes it way easier for us to kind of go through that. Another thing that people make the mistake is they try to come like in between stuff. Like, they're coming in between meetings. I've had patients come, they're literally on a Zoom in their physical. Like, that's not relaxing for you. That's hard for us to have a conversation while you're in a Zoom meeting. So I know sometimes it's hard because we have a lot of responsibilities. Sometimes people are having to commute far to get to the doctors. I have Saturday clinic once a month. It's the reason why I love it is because people are so much calmer. They don't have to deal with traffic. I think they have less, responsibilities on a Saturday versus like a Wednesday afternoon. But I also encourage patients take a wellness day. Like, we take sick days, take a sick day, take a planned sick day to go to your doctor's visit, so you can come, you can be calm, you can take your time. I know I always try to run on time, but sometimes it's hard because you're dealing with humans. And so if one person needs something for you, it may take a little bit longer, and then now it kind of dominoes into the rest of your day. But come in a time where you can be relaxed so that we can just really be present during the visit. Next thing, you guys, is I want to share some questions that your doctor wishes you would ask. These are questions that your doctor wants you to ask. First question, is there anything in my labs that concerns you long-term? I love that question. I love it when my patients ask me that. Have my numbers changed over the years? Are there any lifestyle changes that could reduce my risk or that could improve my health? Love that question. What's one thing I could focus on this year to improve my health? Questions your doctor would love for you to ask. What screenings am I due for now? And what should I plan for next year? Wonderful questions. So I think that's it, you guys. I wanted to make sure. So another thing that I didn't mention is immunizations. So, there's seasonal immunizations, and then there's regularly scheduled immunizations. Your doctors will go over those and which ones are appropriate for you. Please make sure that you have your medical history organized. You know your health history. You know what medications you take. If you're not sure, you can always bring the bottles, and we could just enter them in the system that way. Make sure you have enough time so that you can really be present with your doctor. This is your health, you guys, and it's serious. Even if you just go to the doctor once a year, like, let's make the most of that once a year, that one visit that we have together. Again, I know that God has something great planned for you, and I want you to make sure that you're feeling well so that you can do that. I hope this was helpful for you. Be sure to subscribe. Of course, you can send me any questions, anything you want to talk about. I would love to go, deep and share a video about it with you. Share this with a friend. We all know someone that is getting ready for their doctor's appointment. Oh, just a little note. I think the only thing is our men. I don't want to leave you out because we care about you too. I think the one thing I left out that would be pertinent to men is their prostate cancer screening. We do that with a blood test, you guys, so you don't have to be scared and say, I'm not coming to the doctor because I don't want them. Sometimes that is important that we do a digital rectal exam. Oftentimes we can screen for prostate cancer in your blood. So that's it. I hope this was helpful for you all, and I'll see you in the next episode. This is Dr. Lauren Powell, and I am inviting you to live well now. Take care.